Ambulance service. Is the patient breathing?
We're back on the front line.
West up, better mobilise.
Following Scotland's paramedics.
Top floor fire in a block of 4.
Got an 80-year-old female who's fallen outside.
He's been stabbed. Is the attacker still nearby? I need you to say the word now every time her chest rises.
Every day, they save lives.
Hi there.
We're the first people that people see when life can get quite desperate.
You're okay, you're not going to fall?
You sure?
100%.
And every day, they face new challenges.
Oh, they were going in with shields.
We're expected to dip into everything, mental health, trauma, medical.
But now we're being stretched even further.
Unbelievable.
Listen, I can understand you without swearing.
I laugh in the face of danger.
Sometimes you're seeing people at their absolute worst.
You're fine. You're fine.
Listen, you're in safe hands now, all right?
At the end of every shift, I can go home knowing that I've made a bit of a difference.
This is Scotland's ambulance service, serving over 5 million people in every corner of the country. This time, we're with crews in Inverness, Livingston, and Glasgow.
West up, better mobilise, area, bridge, Glasgow, female threatening to jump, 0375 0330 to mobilise, talk about 4646, cheers. So we're heading into Glasgow just now for a person on a bridge threatening to jump into the water. So we'll get here and see what's going on. I believe the police and the fire service are already on scene. People threaten to jump from bridges in and around Glasgow. We get it quite often, unfortunately. But that's because somebody's in crisis and they're needing help, so they tend to go on bridges and then seek the help. Unfortunately, in some of those cases, they jump, and then obviously it's a completely different ballgame, if you like. Hello. What's going on here? Oh, dearie me. Roadworks.
I don't really get what's... I think they should actually just have a separate lane just to make it easier for us to get through instead of causing this.
Yeah, go ahead.
Yeah, just advise, here at police fire at the moment, we've got a female sitting on one of the sort of lamp posts over the other side of the bridge, not engaging with anybody at all at the moment. Nothing known other than that at the moment.
Yeah, that's all I see. We've been a bit delayed due to roadworks on the M8.
Oh, that's just it, mate, yeah.
That truck just destroyed a cone. Literally destroyed it. He's not giving that to us.
Best time to sort team leader.
Yeah, go ahead.
The police have called in with an RVP and they've asked for a silent approach over.
Yeah, it's all received, understood, thank you. 5 minutes, ETA. Generally, the request for a silent approach comes from the police. So a silent approach is for emergency services to approach the scene with the lights on but no sirens. That's in case you scare the person who's in crisis. The silent approach now, I think, maybe.
You'll get something else.
Oh, look at this, eh? God. Just pull up next to Brian's car. See Brian's car up there? SWAT team here on scene. We arrived on scene and we were met with quite a lot of emergency service vehicles. The bridge was taped off, so police had a cordon in place. And within the bridge there was a female in the middle of the bridge, sitting out onto the river. You could see the police on the bridge and police negotiators on the bridge speaking to the young girl that was there. Who's the PIO? Is that him there? I'm going to speak to him. I'm going to speak to him.
Hi folks, it's been a long night already, it's probably going to get a bit longer. So the situation is, at the moment, we still have the female on the other side of the bridge, with the negotiator speaking to her at the moment. She's still pretty much not engaging with them. They're getting one more bit of answers out of her, they've not got a name, still no idea who she is. And at the moment, the position is we're containing the situation and negotiating it.
It's about working closely with the police and the fire service to come up with a plan. If the patient does enter the water, how do we get them out? SWAT paramedics are trained in water rescue alongside Scottish Fire and Rescue Service and Coast Guard. So our job there is to determine whether we need to deploy our water rescue staff down into the river in case she goes into the river.
Rescue boats are on standby in case the woman jumps into the water.
Female is just up there on the concrete bit. They've got boats in the water, she jumps in, they're just going to take her to the pontoon, which is just over there. I'm not sure yet, they're still trying to engage with her, she's not engaging with anybody. Generally when you get folk who are in crisis on bridges, we generally get to know them. Unfortunately this time we don't know who that is, and that becomes concerning to me as a paramedic, and I'm pretty sure the police and the fire service are quite concerned. The police negotiators are there to try and understand our needs and our concerns, and hopefully we'll try and get an engagement with her. Engagement is quite key. If we get the engagement, then hopefully we'll be able to get her down from there, because she is in a precarious kind of position. If she slips, she's in the water. I've spoken to various patients in crisis on bridges before, and it's quite a traumatic incident for them, but it can also kind of be a bit of a traumatic incident for yourself, because you're obviously kind of trying to coach them down and kind of reason with them that it's not the best idea to jump off a bridge, but you need to understand that they're in crisis and they need your help. In the Clyde just now, the water's sitting about a metre high, and underneath that metre of water is loads of rocks. So you can imagine if she comes off that bridge, the speed she's going to come off that bridge, she's going to go right under that water and hit the rocks. So we're hoping that doesn't happen. So hopefully the police will get a good rapport with her, start engagement and try and talk her down.
Okay, tell me exactly what's happened. Okay, are you with her now? Okay, how old is she?
In the ambulance control centre in Inverness, Fiona receives a call from a young man who has found a family member unresponsive at home.
Okay, I'm just going to run through a few questions. We're getting help as soon as we can. I'm going to give you some instructions to help. It's not going to delay anything. I received a 999 call, and he said that she hadn't been feeling well, and he went to check on her, and he found her lying on the floor and she wasn't breathing. If there's a defibrillator available, send someone to get it now and tell me when you have it. It's always a worry when people are found like that, because we don't know how long she's been not breathing for. The fact that we don't know how long she'd been there, I wasn't quite sure how well it was going to go. Is the defib far away? Okay, could you get somebody else to get it and we can start CPR? A defibrillator is a machine to restart the heart if you go into cardiac arrest. If there's one nearby, then it increases the people's chances of surviving. Okay, listen carefully. Can you lie her flat on her back, on the floor, and remove anything under her head? Okay, and I can just check, you mentioned the vomit. Is there any vomit in her mouth and nose? Okay, what to do is turn her head. Okay, turn her head to the side and clean out her mouth and nose. Don't hang up, go and do it now and come right back to the phone. Okay, so what about her nose? Is there any vomit in the nose? So just clear that out just now. Okay, just let me know when you've cleared that and then we'll start the CPR, but I'll talk you through it.
With the patient still not breathing, Fiona needs to instruct the caller how to carry out CPR.
Listen carefully and I'll tell you how to do chest compressions. Place the heel of your hand on the breastbone, right between the nipples. That's correct. Put your other hand on top of that hand. Pump the chest hard and fast, at least twice per second and 2 inches deep. We've got instructions where we pass on to the caller. We tell them exactly where to press their hands on the chest, and then we tell them to start doing chest compressions, and then we count with them. We don't do mouth to mouth now after COVID. It's all just chest compressions. Just keeping firm, steady pressure on the chest, and just to keep doing the compressions and just keep counting with me at the same speed. Let the chest come up all the way up between pumps. We're going to do this until help can take over. Count out loud so I can count with you. So we're going to go 1, 2, 3, 4. 1, 2, 3, 4. And then we just need to keep encouraging them to keep going because it can get quite tiring, especially if you're doing it for quite a while. 1, 2, 3, 4. 1, 2, 3, 4. Just try and get them to keep going as long as possible. Just keep counting and encouraging them. 1, 2, 3, 4. 1, 2, 3, 4. As soon as I started giving instructions, he just listened to me, and I think he did a brilliant job under the circumstances, because a lot of people will fall apart. 1, 2, 3, 4. That's it. Keep going. You're doing really well. We're getting help. We're going to keep doing this. 1, 2, 3, 4. But I think it definitely helps them, and it gives them something to do until we get the help there, and it makes them feel that they're actually doing something. 1, 2, 3. Right, that might be somebody with the defib. Go and get them. Hi, is that a responder from the ambulance service?
6 minutes after receiving the call, an ambulance service first responder has arrived on scene to assist the patient.
Hello, I'm going to let you go. I'm going to leave you with the first responder. No problem. Thank you. Bye. Bye. You're very welcome. You take care. Thank you. Bye.
First responders are volunteers trained and equipped to respond to medical emergencies in their local area. There are currently more than 850 of them active across Scotland.
That's the first responder arrived on scene now. I'm sure, I think I heard her say in the background to him that she's very warm, but I think she said, I think she's gone. But we'll get that confirmed from dispatch, but that's what it sounded like she said in the background. A lot of the times we won't hear the outcome of it, but in this certain situation, the supervisor did come along and let me know the outcome.
That was an update saying she's deceased, unfortunately.
Oh, what a shame.
It was an off-duty paramedic who's confirmed that. Yeah. You okay?
Yeah, I'm good. I just feel so sorry for that poor boy. Yeah. He obviously didn't realise.
I know.
But he started CPR and everything.
Hopefully he felt he did what he could.
Yeah, he definitely did everything he could. It is a very stressful job. I think if you can deal with that kind of thing, then I would always put myself in their shoes, and you would like to think that somebody would show you a bit of compassion, a bit of empathy.
Okay, does he have any difficulty breathing?
Going to go grab that motor and park it in there. Thank you.
In Glasgow, specialist operations paramedics Paul and Nicole are on scene. A woman is threatening to jump off a bridge in the city centre.
She's not engaging with the police at the moment. We believe that the height of the water is about 1 metre, and there's rocks underneath that. So if she hits that, then it's a trauma job. On that, I think we should get kit out of the motor, so response bag, trauma kit, defib, pelvic binder, etc., and place it where you would think the fire service are going to bring her out.
So fire service boats are going to land her at that pontoon. They've already confirmed that.
If she does hit the rocks, it's going to be difficult to get her out of there. It's only a metre of water, and if she hits that, then it's going to be a lot worse than trying to get her out of the water.
We'll let them know.
So obviously, the situation that we're in at the moment, the patient's obviously in crisis. For us, it's a waiting game to see what the outcome is. So we might have to start looking at our mental health care, our mental health team, and how we're going to support her going forward. I would say folk with mental health problems and in crisis threatening to jump themselves off a bridge or a building, I would probably say it happens in Glasgow. If I'm on shift, I could probably guarantee I'd be at a bridge in Glasgow twice a week, maybe 3 times a week.
Emergency services remain under severe pressure, with added demand due to an increased number of mental health calls.
She's moved from the position she was in, round more to where the barrier is. So we're kind of hoping that she's engaging a bit more with the police. It's a bit worrying sometimes because you don't know what's going to happen. Especially because it's been quite a while now that she's been sitting up there, so she always be quite tired and she'll be quite cold. So she starts making her way around, taking the safe side. All it takes is a wee slip and she could fall in. You feel quite helpless. Initially, I'd probably say it doesn't affect me because I've been to them a few times and it's not that I learn to switch off. You just learn to kind of deal with those instances as they occur. But certainly afterwards, it does dwell on you a wee bit. Certainly when you go home at night, you might kind of sit and think that, have I done this right, have I done that right, is that patient okay, and could we have helped them any more? And yeah, it does dwell on you a wee bit sometimes.
After 90 minutes, the police negotiators managed to talk the woman down to safety.
There you go.
You want to bring her in here and get her heat?
So the patient's now over the correct side of the barrier. She's obviously engaged with the police, so we're just going to go and chat with the police to see if they want us to give her a quick assessment, and we'll take it from there.
Yeah, just advise, that's the female now off the bridge. We're just going to give her an assessment.
We don't really have an ambulance, so what we'll do is we'll sit here just now, we'll assess her, and then
I don't think that she's going to let us. She's been, anytime we've tried to bring her over, she's cooling away and things like that, so I don't really want to overwhelm her. Come on, take a wee seat for me, darling. Okay? Come on, take a wee seat. Sit right there, Phil. Okay?
Have a wee seat, you're all right.
Just take a wee seat, darling, you're okay. You're safe.
Don't sit down for this.
You're safe. Just take a wee seat for me, darling. Take a wee seat. You're okay?
Okay, you're all right. You're all right.
Okay.
Don't sit here for me.
Come on, take a wee seat. It's a wee bit safer if you sit down, darling, okay? You're going to hurt yourself. Come on, come on. Come on, you're okay. You're all right.
I think myself, like most folk, will put a brave face on and get on with it, but there is certain aspects of taking jobs home with you, if you like, kind of maybe a wee bit of kind of depression sometimes, kind of for what you've seen or what you've dealt with that day.
Hi, Aaron. You're okay. You're all right, darling. You're all right. You're okay.
If we're kind of feel a wee bit down, then people in the team will try and bring you up. It's about colleagues and kind of working as a team to kind of make sure everybody's all right.
On the outskirts of Glasgow, another call has come in for the SORT team. Crewmates Steve and Pete are on their way to an incident south of the city.
An 18-year-old girl has been kicked by a horse. They obviously, having the horse, have had a wee bit of a disagreement, and the horse has kicked her. and she's not getting any feeling in her legs.
When we have a job which involves a horse, then we're always thinking about spinal injuries.
I mean, it's blunt force trauma, and sometimes that can be really bad, and a really bad situation.
4523 with the patient, just to advise if you can attend at present, just to make sure you've got enough people to carry down. It's quite awkward, it's downhill, and lots of divots with the horses running about up here, things.
No, that's perfect, mate. We're happy to attend. Thanks for that.
Appreciate it, thanks.
An ambulance crew is already on scene, but they're struggling to move the patient.
It was actually a great call by the Divisional Rapid Response Paramedic. There was a lot of deep burrows in the field, and it could have been dangerous to him and other staff members underfoot, and we didn't want any injuries extricating the girl from scene. So that's why he had asked if we would attend to assist.
Roundabout, what exit? Straight through. Straight through. Watch is quite tight up here, if I remember right. 150 yards, it'll be the next on the right. There we go. Right, right, right. Right, right, right. The paddock, that's the one we're looking for. Thank you.
That looks like a horse.
It's called paddocks. The machine's telling us, no, you're here. No, we're not here. But there's the horses. Now, if this is not it, then I can see the ambulance here.
CCP to Soul Convoy and waiting from the hill.
What's the way on? Roger, Jim, that's us on scene. Where is he?
It's up the hill over there.
Yep,
there he's there. See him?
Yeah, I see him. How is she okay?
She's all right. She's had a bit of a shock.
I went forward first to recce the field to try and make a plan out on how to develop the rescue of the girl to the waiting ambulance.
It's a wee bit uneven. I think
you might be
better going obviously up that way and then
and over. Okay. Let me feed that back to my colleagues and we'll see where we go.
With difficulty accessing the patient, Stevie and Pete will need to deploy their ace in the hole, the Wolverine.
The Wolverine is an all-terrain vehicle which we can use for rugged terrain and going across country. It's kitted out so that we can put a patient in the back and recover the patient from that terrain back to the ambulance. We take it, we deploy it, and we can drive straight out to that patient, and it's a lot safer as well for everybody concerned, really.
How you doing, all right?
Very well.
Hello, I'm Stevie.
By the time we negotiated up the steep embankment up the field, the patient was all packaged by the crew who'd done a really good job.
Take you down nice and slowly. Ready, Craig?
1, 3. 1, 2, 3.
Perfect. What a service.
First, are you happy? Buddy, could you just grab that in there for me? All right, left. Come around.
I'll get it. I'll get it.
Up, my friend. That's it. And then it's a wee guide in. Okay, Stevie.
There's no time limit on us. This nice and easy.
Nice and easy.
With the help of the Wolverine, it's taken the team 20 minutes to securely transfer the patient down the hill.
3, 2, 1, lift. The Wolverine's a great piece of equipment. Sometimes we can't get access with it, but this was an absolute perfect situation where a young girl had been injured, and of course you've got several emergency responders there that can be injured as well. At the end of the day, that's what makes it more comfortable for the patient. So that's what we're here for.
ATC now sorting leader, passing message.
Roger, that's all sort resources now standing down from this job. Just about to leave scene, and you can now close the talk group. Thank you.
Patient is in the back of the ambulance, ready to go to hospital. Over.
Yeah, that's all received, mate. That's perfect. Thank you.
Stevie and Pete are both long-standing members of the Special Operations Response Team.
I started in 2008 and Pete was just the year after that in sort, and I've taught him everything since then.
Why I'm so big, because I carry him everywhere.
See, after the last couple of years with COVID and everything, when they were all locked in their houses and unable to do everything, it's nice to see the young ones out and about, isn't it?
Aye, it's nice to see them on the horse rather than lying on the ground off the horse.
That's right.
Right, offies we go. It's a lovely day. Like, where are we going?
Camp Shag.
Camp Shag, I'm right.
So we've got Alexander, he's 88 years old and he's had a fall and he's bleeding from the face. So he seems to have injured himself.
At least it's not a hip injury.
Well, we don't know. I don't jinx it.
Oh, sorry, let's not jinx it.
Jamie and Anne-Marie have been working together for a year.
How can people, I say, can wear a jacket, but I'm sat in here with a jacket on, but it'll be coming off when we're outside, I think.
So people just like cooking, people like a sauna.
There is, but then you've always got people like that wear shorts no matter what the weather is. It could be ice, snow, rain, whatever, shorts are on. I'm definitely not that type of person.
Anne-Marie is studying to qualify as a paramedic.
This is the type of weather that I'd love to be off. Weekend with mum and dad, music on, out in the garden. A wee gin or two, umbrella up, keeping me safe. I suppose there's many reasons to why people find themselves in this job. It was actually watching programmes on the telly with all the paramedics that I would find myself fascinated with them. With my mum being medical, being a nurse, I've always been open to opening her books and looking at medical things. Indicating up here on the sat nav. With that wee white house. There we go. And my papa's like, you could do that. I was like, oh, don't be silly. And 10 years later, here I am.
Hi there. All right. What is it you answer to? Is it Sandy or?
Alec.
Alec.
Right.
Hello,
I'm Jamie.
Alec.
Nice to meet you. What's happened?
I just lost my balance when I was turning around the corner, and well, it's as simple as that.
Do you remember going down?
Yeah.
You don't feel unwell before, just simple
No.
loss of balance?
I was sitting in the conservatory, it's maybe too warm in there.
Alec's stepdaughter found him and phoned for the ambulance.
People don't want to get their relatives off the floor, so they just leave them where they are, which is what they should do until somebody like ourselves have come and assessed them to make sure there isn't immediately anything. Because if you've got a broken hip and you're trying to walk on it, it's not going to do the best for it.
Are you in any pain?
No.
Okay. You can move your neck and that okay?
Oh, yeah.
Lovely. Well, we get you up off this floor then.
If you don't mind.
There's an apprehension when we're going to anyone elderly that's had a fall, because they're that much more likely to have had sustained an injury.
I think when we were reassured with how Alec was wanting up off the floor quite quickly and he had no pain anywhere, that
Yeah.
we were able to just put the chair in front of him and encourage him to get up.
But then, to be fair, I think he was that stubborn. I think if he did have a broken leg, he was still getting himself up off that floor.
Yeah.
Okie doke. How you been lately?
I've been all right. I've been watching myself, but I just lost the balance coming down the corner.
Would you say you're coping lately? Or has things been getting more difficult? Basically what I'm getting at is, do you feel like you need extra support at home, or are we still coping with what we have in place?
Well, there's times I need extra, but
Okay.
it's the lads make my meals for me.
And what about your personal care? terms of getting showered and things like that?
I'll be come about twice a week.
Okay. What about family and that? Have we got anyone nearby?
Yes, my stepdaughter, she gets my messages every Friday and does my hoovering and dusting and the Monday. And the general look after them. They're very good.
Okay, so what's came on you though? Is it dizziness or is it a loss of balance?
Both.
Okay, so there might be a bit of drop of blood pressure then that's maybe kind of been the cause today.
Yeah.
What I'd like you to do, see once you're feeling a bit more yourself, we'll get your walker. If we can get you to sit in a chair proper in here, and I'll do a full tracing of your heart. Is that okay?
Yeah.
Alrighty.
With anyone that has any falls, we need to make sure that there is no other issues underlying.
It was reassuring to see that he did have some strength to push himself onto his feet once he got his feet under him, because a concern with Alec would be, is he going to cope at home? He is recently discharged from hospital, and is he a failed discharge ultimately? Does he need to go back in?
So when did you have the fall that took you to hospital?
Christmas week.
Okay.
3 months I'm in hospital.
Oh, you were in for 3 months?
Yeah. I couldn't find a cure in the room as such. It was my blood pressure.
Were you quite ill while you were in there?
No,
just
I felt as I was wasting my time.
Just, but you weren't safe to go home was the issue?
That was their interpretation, yeah.
But you didn't agree fully? Well, you got home, that's the main thing. Alec was pretty clear from the get-go that he wasn't wanting to go to hospital, he was wanting to manage, quite an independent man. Have you ever had an assessment for your mobility at home? Like a specialist like falls team? Seems like you've got kind of fairly clued up, you know, and you've got your falls pendant, that's kind of the main one. The council were coming out to do an assessment since he hadn't long been discharged, I think it was that week. They were going to come out and assess his home. They can put in certain sort of stand aids, handles around the house and make sure that he's got everything that he needs. And that's a referral that we often do for people that have had falls, but that was already in place.
Jamie and Anne-Marie check for any potential new causes for Alec's latest fall.
123/76, your blood pressure's getting better each time.
It goes up to like yo-yo.
But his results all come back normal.
If you're telling us this is your normal, we're inclined probably just to leave you to get on with things. You've got your pendant there. If anything was to change, that's when you press it and we come back, all right? Alrighty.
So I clocked a wee picture, I think that's your good lady on your wee mantelpiece there. That's your late wife.
The happiest years of my life.
Oh, lovely.
It's now that I miss her.
Of course, yeah. How long has she been away, if you don't mind me asking?
12 years she died.
Still probably feels like yesterday.
Lung cancer. It's a hell of a thing, cancer, isn't it?
Definitely, has a lot to answer for. So you were sort of a sun worshipper?
Yeah.
Did you used to go on holidays in your younger years?
Yes, we went to, when we were both retired, we went to 2, sometimes 3 holidays a year. To Med and Canadian and such like. All the white cases they are all movies. Kids were the day they were born right up in all our holidays.
It's nice to flick back through all those memories and look at the home videos. Although I know I'm starting to age a little bit. When my little brother was like, what's a video? I was like, get out.
Oh, you're getting old.
I am getting old. 30's coming thick and fast.
In June I'll be 89.
Wow. Do you feel it though?
No.
There you go.
Well, aye.
I know.
Times. But at least now.
Bet you absolutely love that you've got those videos there to look back on.
At the time you didn't think much.
You don't, no.
But now, the circumstances now, I've got them.
Can hear her voice again?
Yes.
Yeah, I think that.
See her walking about. I know I've got to be careful.
Aye, I think you need to...
They've just turned in the corner here and just film.
Aye, but see if you have been sat there, it is nice out there in the sun, but see if you come in, make it to here at least, and sit and have a drink, top yourself up and before you get going again. If you're doing too much, it'll set yourself back long term. Yeah. That's my row for the day anyway, all right? It's nice meeting you.
Well, love yous and leave yous.
Right.
You're more than welcome.
You taking the bag in that?
Yeah, I grabbed the bag.
It is nice, eh?
Can't wear this jacket anymore. Roasting.
That moustache looks like it's a good 30 years old. Like he's
Were you a bit jealous going, why is my moustache not like that?
No, it's not even that. He's went, that's me one day, and he's just stuck with it now.
Yeah. My papa was the same. He was like that and had a lovely moustache. He was getting a bit tearful when he was talking about his home videos with his wife that he sometimes watches. I think I'd be the same, but I think those are nice wee memories, like when you've lost somebody and you start to forget what they sound like and what they look like, and to be able to have that, to look at it, it's nice. It's probably emotive and upsetting, but quite nice at the same time.
Yeah. I think sometimes because we live in this digital age, we don't really archive stuff a lot.
No.
I think about all the videos and photos I've got of the kids in different places and different memory cards and stuff.
And if you lost them, you lost them.
It's not even that, it's just more, I should curate them a wee bit, maybe put them together and preserve them.
They're nice memories to have, like, because you really never know how long you've got with people.
Livingston lies between Glasgow and Edinburgh. It sits in one of the most densely populated parts of Scotland. Amy and Andrea are in the middle of their shift. Their break has been interrupted by an emergency call.
I've got ineffective breathing from my toast that's lodged in my... from the toast that's lodged in my windpipe.
I'm proud to say I'm a paramedic. Like, it's a good job, and people say, "Oh my God, that must be so interesting! Like, you must see so much stuff." Like, people are really interested when you say you're a paramedic, and probably not quite a job like it. I don't think.
Oh dear.
You all right?
I'm fine.
You doing a few back slaps?
Big hunk of toast are gonna fly right out.
Stories you hear in the back of an ambulance are something else. Like, I think people think, oh, the doors are shut and then they just tell you their life story.
Tell you everything.
Oh, people are interested in it. It's good.
So we are going to a purple call for a 55-year-old male who has fallen and can't get up.
So our purple call is our highest priority call. So that is basically someone who is in cardiac arrest or who has ineffective breathing and is likely to go into cardiac arrest kind of imminently.
Someone has described him as having agonal ineffective breathing. So it's the highest priority call, and we're literally less than a mile away.
Ineffective breathing is you cannot speak a word, let alone a sentence. You're really, really struggling. You're blue at the lips. You know, sometimes purple at the face is what we see when someone's really, really struggling. It's not, you're not breathing regularly. You might be breathing less or more than you should be.
There's a learner here. Oh no, this is not good.
Oh,
this is not good.
Panic stations, panic state. Oh, you can just imagine the fear. You're all right.
You're
Thank
fine.
you.
Just stop.
Well done.
Well done, little learner.
Well done. Oh, I've been in here before. There's two doors open. There's someone. Oh. Hi, my love. What's been happening?
I had a cold.
Right.
You want it, Joe? Sorry.
You feel really, really warm.
Yeah.
Really, really
Been
warm.
there for a short time.
For a couple of days.
Yeah.
And so when did this all start then?
Tuesday.
Tuesday.
Thursday.
So it's 2 full days. And tell me again what you've had. So you've just been not feeling yourself. You've been feeling hot. Coughing.
Oh, no. Sorry.
And have you been coughing anything up?
No.
Okay, so just a dry cough.
Yeah.
And have you taken a COVID test?
No.
No. Have you had COVID previous to now?
Yeah.
He had a high temperature, he was achy, he just was feeling a wee bit kind of rotten basically, and so really you're thinking there's nothing else kind of abnormal was jumping out.
While Stuart's condition isn't life-threatening as initially reported, Amy and Andrea still need to find out exactly what has happened to him.
Do you think you collapsed and lost consciousness? Or do you think you just felt a bit dizzy and lowered yourself to the floor?
No, I felt really dizzy and I just like fell over.
Right. Was it you that phoned? Did it just happen just then?
Basically,
15 minutes ago or so?
Lovely. So do you have any problems with your heart normally?
I get blood pressure medication.
Okay. For high or for low blood pressure?
High.
High. Are you diabetic or epileptic?
No.
No? Should we try and get you sat up?
Okay.
Yeah, because your blood pressure's okay. We'll maybe get you sat up and we can maybe strip the top of this dressing gown off.
Just check a wee.
And you've got that wee fire on as well. It's toasty in here.
It's nice and warm in here.
So you've got a temperature of 38.3. So that's a little bit higher than we want it to be.
Right, Pam, I'm going to take a wee spot of blood out your finger and just check your sugars. Is that all right?
Yeah.
7.2. Perfect.
Your heart rate is perfect and your blood pressure is on the higher side of normal, but it's not anything that we're overly worried about if you've been seen for it, okay? It's already known. Right, do you want to try and get yourself up nice and slowly and sit onto your bum?
Yeah, that's a good man. Oh, what a shame. Perfect, good job. Well done.
Do you think you've been drinking enough over the last couple of days?
4 or 5 bottles of water.
Oh, perfect. That's a good amount.
And just check this again, just now that you've sat up all right, see if there's any change in it. You don't feel dizzy or that?
Is this...
No, I don't feel now. No.
So good.
And is this the first time you've felt dizzy since you've felt unwell?
No.
Have you been feeling dizzy since you've
Been unwell, yeah.
been unwell for the last 2 days?
But no like that. Does that make sense? I felt dizzy, but no dizzy.
Just not to that extent. Can I have a little listen to your chest whilst you're sat up?
Yeah.
Right, I'll just pop this on you. It'll feel quite cold against your skin because you're quite toasty. And then we'll do an ECG on you too.
You can just sit nice and still for me for a wee 20 seconds, all right? We'll get this wee picture and then we can let you get your...
That one's just coming off.
Let you get your, take that again, all right? Because that wasn't there.
That's just came off.
All right, okay.
Might have to give you a shave and give you a little patch.
All his observations were absolutely fine. He had a bit of a temperature. He also had like a really thick house coat on.
And the house
was warm. The windows were closed. You know, so even just basic stuff like open the windows, strip off, paracetamol fluids.
That would have probably made him feel a lot better. Obviously, when you've said you've been feeling unwell for the last 2 days and you've had sort of feeling a wee bit dizzy and you've had a bit of a bad head and you got a blocked nose and things, and sometimes that can just be part and parcel of like having a head cold, having sort of blocked sinuses, etc. Everything that we've found is okay. So it's really up to you what you'd like to do. The option is there to take you up to hospital if you'd like to go to A&E, or sort of we can leave you here. We can phone the GP if you, the out-of-hours GP if you'd like an out-of-hours GP appointment. For yourself though, like I just said, like you sound like you're doing all the right things. You're keeping your fluids up, getting lots of rest, regular paracetamol. Don't exceed the dose that it says on the box, so just 4 lots of 2 and you'll start to feel a bit better. If you don't feel better, or if you were to have more dizzy spells, you start to get inner ear pain, you start vomiting profusely, just phone us back. It's really not an issue.
Thank you.
Should we leave one of your ECGs here? So this one was a pretty good copy actually. Just in case you ever need anybody out again, and then they've got an ECG just for comparison. Okay, and I hope you feel a little bit better in the coming days.
With Stuart's observations normal, Amy and Andrea leave him at home to rest.
Thanks, Stuart.
Bye.
Ambulance service. Is the patient breathing? Is the patient awake?
In Inverness, Julie is 9 hours into her 12-hour shift.
Right, listen. First of all, you don't need to swear, okay? I can understand you without swearing. What's the address of the emergency? What is the address of the emergency? We are subjected to quite an amount of abuse. That can be challenging. Can you confirm the address of the emergency, please? No, I need the address. What's the address of the emergency caller? I was always told that as soon as you raise your voice, you've lost the argument. You know, that's in any case in life. So obviously if the caller's shouting, what have you, I just keep an even keel, I just keep an even voice, an even tone. You do have to be authoritative and you do have to be firm. You don't raise your voice because that's not going to get anywhere. Hi there, hi, it's the Scottish Ambulance Service. Can you please confirm the address of the emergency to me, please? Right, just bear with me. Okay. And is she outside or inside the property? She's outside, right. Okay.
Julie has received a call from outside a pub.
Okay, tell me exactly what's happened. Right, okay.
A woman is having a seizure in the street.
Are you with the patient now? So when you're speaking to people in that scenario, they're in a pub, you know, alcohol can be a huge influence on the caller. And right, you know, they're in a pub, they're having a night out, they're socialising, they're enjoying themselves. There's lots of noise, as you can imagine. There's lots of chaos. Right, sir, in order to help, I need to ask these questions. I find as well in a public place, everyone wants to help. So everyone's in, call it shouting in the background, but I need one caller, one person who's with that patient to listen to me. Has she had more than one fit in a row? It's not delaying the ambulance. Has she had more than one fit in a row? I know, I understand that, but I do need to ask these questions. Does she have a history of stroke or brain tumour? That's fine, thank you. I'm just taking note of the information you're giving me, okay? Thank you. Has the twitching stopped yet? So I'm organising help for you now. Stay on the line and I'll tell you exactly what to do next. You're welcome. If she is still fitting or if she starts to fit again, don't do resuscitation, don't hold her down or put anything into her mouth. Move dangerous objects away from her and tell me immediately when she stops fitting. They're coming on blue lights as fast as they can.
After 6 minutes, the woman finally stops fitting.
And sir, confirm to me, is she awake? She's not totally conscious. So is she awake at the moment? She's not awake at the moment, right, okay. Right, okay, so what we're going to do is check her breathing together to make sure it's all right. When I say go, watch her closely and tell me each time her chest rises. Are you ready? When the fitting is stopped and they're not awake, we have a breathing tool because we need to check their breathing because maybe their heart rate's really slow, maybe they've stopped breathing. Okay, so are you ready? So start now. First breath, second breath, third breath, fourth breath. That's excellent, thank you, sir. So turn her gently on her side, okay? As she wakes up, reassure her and tell her not to get up or walk around, okay? Is that the crew there? Just tell me when they're right beside you. I always wanted to be in the care sector like this. Are you going out onto the street to wave to the crew, sir? Where you're in an emergency service and you feel that you're doing some good in the world. Are they approaching you now? You've got them now, okay. I'll let you go then. You take care, thank you. Bye-bye, bye-bye. And if I was younger, I would be out on that road in an ambulance serving the public because I've always enjoyed caring. The reason I come back to my job every day is because I just love helping people.
So we're getting help to you. If you get worse in any way, call us back immediately for further instructions.
In Dunfermline, Davy and Eileen have just begun their 12-hour shift.
Right, this is came in from a GP who has seen this 81-year-old male in Dunfermline. And it is querying a CVA, which in other words is a stroke victim.
As the patient is diabetic, Davy and Eileen need to consider whether that underlying condition could be contributing to the patient's symptoms.
However, it may not be. because sometimes if your sugar levels are low and you go into a hypo, it gives you very similar symptoms.
When it comes to dealing with a possible stroke, the sooner a patient gets treatment, the better.
And this is where I take my life in my hands.
Eileen has been listening to Davy's jokes for almost 5 years.
Makes life a lot easier if you can go on and you hear about a joke
Yeah.
and laugh about things.
Yeah.
It makes things
That's
a
the
lot
other thing.
easier.
We've got the same sense of humour. It's like any other job, you know, you've got thousands of people working in this service. You're going to get clashes of personality. You are, and it's just, and sometimes it is trial and error, but you do the job. One day he will end up walking, but if he carries on, he won't even be walking.
People used to say your life flashes before you, before anything happens. I've had that for the past 4 or 5 years.
With a suspected stroke, time is of the essence. But when Eileen and Davy pull up at the patient's address, they are greeted with an unexpected sight.
Well, okay. Oh, you can walk.
When we pulled up, Peter and his wife were already outside the house, standing there waiting for us with their bags.
So what we need to do is assess you. So we'll get you round in here.
He walked to the ambulance, got in the ambulance, sat down, started talking to Dave. He was absolutely sound, seemed fine. The only issue was he was having problems with his eyesight in one eye. Squeeze in. All right, so I'll shut this.
Although Peter looks well, Davy needs to find out more about his symptoms in order to decide where he should be taken for treatment.
What's been happening to you?
I was just welcome. This one makes me blind in this eye.
You went blind in this eye, and you any paralysis in your...
No.
You ever had a stroke before?
No. Peter, you better tell them what that is, because he's got glaucoma, and he's got something happened at the back of his eye, so he's diabetic. Diabetic.
Davy needs to work out if the patient Peter has had a stroke, as his GP suspects. He carries out the standard test for strokes, known as the FAST test.
So it's F for face, then A for arms, S for speech, and T for time to call for an ambulance.
You're looking for, do they have facial expression? Do they have a droop? Can they smile?
If it's a full-blown stroke, it can be pretty obvious because they'll have a weakness down one side.
After conducting the FAST test on Peter, Davy has some encouraging news.
Your FAST test negative.
But Davy and Eileen still have to figure out what may be causing Peter's sight loss.
So you've got reduced vision in your left eye. Have you got any pains in your head, like a bad headache? Nothing like that. Do you have any problems with your blood pressure? Right, so you have high blood pressure. And I just take this off the now. Can you see that light in your eye? And this one? Right. Can you see my finger? Just keep looking this way. Tell me when you see it. You just seen a shadow, right? How many fingers have I holding up? If I went like that, can you see them?
One.
Right, that's okay. So it's reduced vision in your eye. I don't know what's causing that. He did have visual disturbance in one of his eyes. We were concerned about this. So just to make sure everything was all right, I contacted A&E. Hi, this is Dave Gibson, one of the ambulance clinicians. He's not having a stroke. He's fast test negative, no paralysis, that he has reduced sight to practically no sight in his left eye. So what do you think? Yeah. Yeah. Right, okay then, right. If you transfer over.
While Davy talks to the doctors at A&E, Eileen reassures Peter's wife, Margaret.
Because this is an emergency, or something like sudden, he might need to be investigated by the medical team.
Right, he needs to come in. Right, okay then. No bother, that's great, thanks very much. And his view would be, because of the sudden deterioration, there may be something that's going on.
What began as a suspected stroke now appears to be a different but still serious condition. Peter is taken straight to hospital for urgent checks.
I spoke to the consultant in the A&E. It may be a bleed in the eye. So we have to get that seen to immediately or as quickly as possible, or he could lose the sight altogether, or it may develop into a more serious medical condition. So the patient has therefore been taken in to what the class is the eye room, which is the specialist room. They will examine him and then they'll take it from there.